Hi, I'm Chris Westfall. I'm in Charleston, South Carolina. Today I'm going to answer a question. What is open enrollment, and when you're turning 65, how healthy do you have to be to get a Medicare supplement? Stay tuned. Hi, I'm Chris Westfall. I'm in Charleston, South Carolina, and I have non-resident insurance licenses in over 45 states across the country where I help people over the telephone with their Medicare choices. And today I want to answer a real common question that we get. We get about 100 referrals every month from people who've already been part of our service or know what it is that I do. And the biggest question is somebody will be turning on to Medicare for the first time, turning 65, and they say, well, I've got some kind of a health problem. You know, maybe I had a heart attack recently, or I've had a stroke, or I've had cancer, or I have diabetes, or I have some kind of chronic condition. And their question is, will that prevent me from getting the best Medicare plan, whether they want Plan G, Plan N, etc. So the answer is great, and that is if you're in your open enrollment period, that's 6 months before you start on Medicare, or 6 months after you just started Medicare Part B, you have no health questions to get on to whichever plan you want to. The insurance company cannot deny you to get onto a plan as long as you're in open enrollment. So you get that open enrollment 2 times in your life, or possibly 3. The first is when you're turning 65. That's the best time. You can pick a plan and even lock it in 6 months before you turn 65, or 90 days in West Virginia. Or 6 months after you turn 65, you can still get an open enrollment Medicare supplement plan. And again, any plan that you want. The other time is when you're starting Part B for the first time. And that may be because you're on an employer plan and you're just now retiring. You're just now leaving that employer plan, or they're doing away with the benefits. And so now you need to get on Medicare Part B for the first time. That's the second period. And the third is if you're under 65, you're on Medicare due to disability, you get an open enrollment period when your Medicare first starts, and you get a second crack at it when you turn 65. In any of those cases, we can probably help you, no matter what state you're in, to pick the best plan for you. And again, it's all a matter of customer service then and price, because the health considerations are simply not there if you're new to Medicare in your open enrollment period. So don't be concerned, and if you're considering referring somebody, it doesn't matter what health conditions that they're in when they're turning 65, because open enrollment covers that. And then the next question is, what about pre-existing conditions? Is that going to be covered? Some companies in the Medicare space do not consider themselves concerned with pre-existing conditions at all, and we know what those companies are. Other companies go by what the law allows them to do, which is if you've had continual coverage up until the time that you're starting on the Medicare supplement plan, then there is no such thing as pre-existing condition. A pre-existing condition is when you don't have insurance, then you get insurance to get coverage, and then whatever was right before that period is not covered. So as long as you don't break 62 days of continuous coverage, let's say you're on an individual plan, you were on another Medicare supplement plan, or you were on a Medicare Advantage plan, or you're on an employer plan, as long as no more than 62 days happens between the end of one coverage and the beginning of our new coverage, you're fine. No one's going to hold that against you because you had a continuity of care. You had continual coverage, so it's not considered pre-existing conditions, and it cannot be excluded. So hopefully that clears it up. If you've had continual coverage and you're just switching your Medicare supplement to a better plan, because we have a lot of people that do that, they'll find out that we can shop the entire market, they'll give us a call, and we save them money. As long as they've had continuous coverage, there's no problem, there's no consideration of a pre-existing condition, it just continues to be covered. And remember, Medicare supplements are accepted at any doctor and any provider that accepts original Medicare. And that's about 97-98% of doctors across the country. So if you're in one of our 46 states and you can give us a call, we can tell you what those are. We can shop the market for you and very easily and very securely help you get signed up over the phone. It's so easy. Give us a try. Or if you've already signed up for a plan recently, we've had that a couple of times here in this busy Medicare season. People signed up for a very expensive plan and called us for a second opinion after they saw one of my videos. That's a good move because we've saved them both money that did that this week. So if you've just got a plan or you want a second opinion, feel free to give me a call too. Thanks so much from Charleston, South Carolina, and that famous Ravenel Bridge there. I'm Chris Westfall. Thanks for watching. Bye-bye.